Good morning, Mr. Smith. My name is Ansley. I'm going to be your nurse today. We're just going to be checking out that central line, changing your dressing and drawing some blood from it, as well as administering your medication. All right. Can you go ahead and verify your name and date of birth for me?
Willie Smith, 4794.
Perfect. And you don't have any allergies, do you?
I don't.
Okay, perfect. Are we in any pain this morning?
No, I'm not.
All right. So I'm going to go ahead and put on my gloves real quick. Get this gown down. I'm going to go ahead and place a mask on you. And a mask on myself as well. There's no dressing on the mannequin at this moment, but we're going to pretend that there was. We're going to go ahead and remove the initial dressing, making sure we know if there's any drainage or anything showing signs of infection. And then we're going to clean up around the site with an alcohol pad, just making sure we get all that stickiness off his chest. We're going to go ahead and switch over to our sterile gloves. We're going to use our ChloroPrep, making sure we're cleaning in horizontal lines, making sure we stay sterile and get the area nice and clean around there. We're going to go ahead and replace around here. Well as replacing the dressing, not pulling it out like that. Alright, and we would name and date it as well, just to show that I was the one who changed it, and also we changed it at this time and date. All right, so once we have that new dressing on, we're gonna go ahead and draw some blood from the site. All right, I'm gonna go ahead and remove these gloves and put on some clean gloves. So if we had any IV medications administering, we would make sure to pause those and detach it from the site. But we're gonna go ahead, since we don't have that, we're gonna go ahead and take this green port off. We are going to scrub the hub. making sure that we keep it nice and clean. We're gonna take our flush, attach it here. We're gonna flush a little into the line, making sure that it's patent and allowing whatever we're trying to put in go in. And then we're gonna pull back until we have about 5 milliliters of waste blood. I'm gonna take that off and dispose of it in our sharps bin. And then we are going to clean the hub once again. Give that time to dry, and we'll get our syringe that we're gonna pull out the blood in. All right. We're gonna pull out however much blood we need to fill the tubes that were ordered by the doctor. And then once we have that, we're gonna take our top with the alcohol and we're gonna place that back on top, making sure we have it clamped shut. All right, then we're gonna put everything in our tubes, put it in our biohazard bag, and send it off to the lab, making sure that it has all the appropriate patient information, that we've scanned it and put it in the chart as well. All right, and then for medication administration, we are gonna come back to the same port. We're gonna make sure that we unclamp the tube, that we take our alcohol wipe, and we're gonna scrub the hub as well. At this point in the process, I would have already made sure to draw up our medication, that it's in the proper syringe, that we have the proper medication, proper dose, and proper patient already lined up in the MAR. Obviously not drop it. So we'll have our medication ready. We'll put it on the port. And since we drew blood, we already know that this port is patent. And then we'll push our medication in. Some medications require you to push it in slowly over time. It just depends. But if we do run into that the medication is not pushing as smoothly as we like, we can do a pulsing administration, just making sure that we're not forcing any medication into the port. All right, we're gonna clamp it. We're gonna clean it off with our alcohol wipe again. And then we will make sure that we have a new cap to reapply that. All right, once we've got them all set up, we're just gonna make sure our patient is feeling okay, not in any pain. We'll remove his mask, set him up, lower the bed, make sure he has his call light, make sure wheels are locked, dispose of everything properly, and make sure that we document everything that we did today.